Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. National Population Commission conducts free COVID-19 tests for enumerators ahead of the proposed 2021 national census. Edo State government to strengthen health sector prioritizes insurance scheme for local communities as state tackles second wave of COVID-19. And Moderna ready to test booster shot to target South African variant of the coronavirus. We begin in the nation's capital, where the Federal Capital Territory has the highest number of active coronavirus cases in the country. A list of the top 5 states with cases on admission shows the FCT in first place with 7,145, while the epicenter, Lagos, with the highest confirmed cases of over 55,000, is managing 2,128. In third place is Nasarawa State with 1,822 and over 1,000 are being treated in Oyo State, while Ondo is managing 807 cases. Total active cases stand at 21,116 across the country. Meanwhile, the trend of cases continue below 700, with the NCDC announcing 655 new cases of the virus. Now, this was confirmed in 20 states and the Federal Capital Territory, with Lagos recording the highest, 240, followed by Ogun State, 88. Rivers recorded 56 cases, the FCT 51, Kaduna 43, 25 in Kano, Plateau recorded 21, Taraba 18, 17 in Edo, 15 in Abia, Delta recorded 13 cases. Nasarawa 11, Akwa Ibom 10, Kwara 10, Oyo 10 as well. Kebbi recorded 9, and you can see the cases 5, 4, and another 4 again in Gombe, 5 in Borno, and Bayelsa recording 4 cases and 2 each in Ekiti and Osun State. Now, while 11 deaths were also recorded, showing a rise in the death toll from the disease, raising the total fatalities to 1,885. The report from the NCDC also includes 297 community recoveries in Lagos, 93 in Edo State, which was recorded over 2 days now. Till date, our total cases stand at 153,842 confirmed cases. As part of preparations for the next census exercise, the National Population Commission, NPC, is conducting free COVID-19 tests for enumerators in Lagos State. The Commission, which has begun the enumeration area demarcation exercise across the state, has conducted 170 tests so far. The Federal Commissioner representing the state says the coronavirus tests are being funded by the Lagos State government.
We thought in our wisdom, and I want to thank Mr. Babajide Sanwo-Olu, the people's governor. That's what we call him here. Because when we approached him, that we have 170 functionaries that will be going around houses. That's what we do. We number the houses and then we take samples. That's what enumeration area demarcation is. It's data taken at disaggregated level. So we take these samples. For our people, it's not that we've had a report of anybody having COVID, but we know that for us to be certain that we are not coming in, we want to be alive to count those who are alive. Let me put it like that. And he's been gracious enough to permit us to have this COVID test free of charge.
All over to Edo State, where the government is prioritizing the establishment of health insurance schemes to cater for millions of citizens, particularly in the rural areas. This is one of the ways they think health infrastructure could be heavily enhanced to cater to the disruption caused by the coronavirus pandemic. The Director General of the Edo State Health Insurance Commission explains that a lot of energy is going into the scheme in the state. Our correspondent Osaze Obaze reports.
The World Health Organization ranks Nigeria 187 out of 191 countries for health service performance, rating Nigeria's universal health care coverage grossly underperforming. The new Edo State Health Insurance Scheme and the already existing National Health Insurance Scheme are efforts which the state government says is to shore up the latitude of healthcare delivery coverages. The Director General of the Edo State Health Insurance Commission strongly believes that the coverage of the Edo State Contributory Health Insurance Scheme is all-inclusive and quality control is monitored.
The health insurance in Edo State has been designed to have an inclusive spirit for everyone, which means that everybody in society, be it old, be it young, be it a man or woman, irrespective of a geographical area or even your level of income, you'll be able to access the health insurance scheme. We have a unit called the Quality and Assurance Unit in our health insurance space. These guidelines are set based on manpower, based on equipment, based on materials, and based on all the resources.
It guarantees accessibility in the rural areas as well as the urban centers, insisting a working plan is in place for that.
In our state here in Edo South, we have about 79 workers, and then in Edo Central and Edo North, we also have workers that are in collaboration with the local government and the primary healthcare agencies that are also scaling down activities there.
The primary healthcare sector is a critical tier of the state health insurance scheme.
Primary healthcare is the first level of contact of individual, family, and even the community to health system. So and that is the fundamental. If the primary care is is functional and bringing it to the doorpost of persons, you're actually achieving universal health coverage. So achieving universal health coverage is also making the health services, apart from it being effective, at no cost or little cost.
Some of the enrollees consider the healthcare delivery initiative as a laudable new vista for people to buy into.
I think the health insurance scheme is a beautiful initiative from the government because accessing health is not something that is cheap.
The initiative is a positive one in the state as regards the health. As we all know, health is very important.
To the man on the street, not much is known about the Edo State Contributory Health Insurance Scheme.
I've not heard about it. I'm just hearing it for the very first time now.
I was just walking when I heard about it on radio, but the detail, I didn't actually know anything about it.
The board therefore appears to be at the feet of the government to continue its enlightenment program in this regard. The Edo State Health Insurance Scheme also provides referrals to higher level healthcare tiers in the scheme if the care required by the enrollee is beyond primary health care. Osazo Abaza Channels Television News.
And neighboring Delta State, where the House of Assembly is one of the arms of government that has been hit with the deadly coronavirus, with some members battling the virus. Unfortunately, one death was also recorded, that of the House Majority Leader as a result of COVID-19 related complications. Well, the Speaker of the State House of Assembly, who has beaten the virus, narrates his experience.
It's God that saved me. Not just only me, including my wife. Because my wife and I are living testimonies of what happened. For 2 weeks, I was unable to eat. Went through the process. And I said, what kind of virus is this? And it was tough. It was hectic. And if I start talking now, you will not understand. It's only those who have passed through the process will understand the effect of this thing. Like when some doctor will say, Mr. Speaker, the one you have is the new variant, which is the one, the UK type and all that. And even when I'm recovered, I was still having this hiccup. Just having that one again took another over 2 weeks. So it's a very bad experience.
Well, let's talk to a public health consultant and pharmacist, Nsebasi Ekanem. He joins us via Zoom. Thank you for joining us on the program. I'd like to begin, Mr. Ekanem. Are you worried, and this is especially of the threat of the virus variants or strains and its threats, to the fight against COVID-19?
For me, this is quite worrisome, given the fact that we are seeing new strains of the virus having some level of, resistance to the vaccine. As a matter of fact, for some of the vaccines, like AstraZeneca vaccines, we are already having concerns. The only good news is that for those vaccines like the Pfizer and the Moderna vaccines, there's still that level of, protection for persons who have taken those vaccines against the new strain. But ultimately speaking, based on the facts that we have and the research carried out so far, there is need for us to develop new vaccines that can tackle the new strain. I think AstraZeneca and Moderna is also working towards a booster dose, the third dose, which is the booster that will help, protect people against the newer strain of the virus, like we've seen B117 and the rest of them. So it's worrisome, and we are hoping that the manufacturers of the initial vaccines will also work towards bringing up vaccines that will help protect people against these newer strains.
And perhaps that's also another question. Is it possible to update vaccines that already exist for COVID-19 to the mutating SARS-CoV-2 virus and the variants? I mean, we're hearing some vaccine manufacturers like Moderna say it's readapting, its current vaccine to fight it.
Yes, it's absolutely very possible. So what we are looking at now, for example, the newer versions of the viruses are the ones that have higher affinity to what we call the ACE receptors within the nasopharyngeal orifice. Now, what the new vaccines will do is to reduce that affinity. So there's a way we can tweak the current vaccine a little bit and administer those ones as a booster dose, and those ones will be specifically effective against the newer strain, since we understand the pathogenesis and, of course, the nature of this newer strain. So it's very possible for us to tweak the current vaccines a little bit and get something that will be very effective against the newer strains.
I'm sure a lot of people are curious as to the process, but then, in the long run, do you see us creating multiple vaccines for multiple mutations of the virus?
Honestly, we might be pushed to that level. Because as we are now, most of us in the public health, ecosystem are becoming very worried. And if the current vaccines that are available do not have or do not provide that efficacy against the newer strain, then it is highly possible that we have to come up with newer, versions of the vaccine that will be much more effective against the newer strains of COVID-19. But I want to also say that, COVID-19, like every other virus, mutates based on this transmissibility. Now, the longer we have COVID-19 around, the higher the probability of us having newer strains. So one way we can help to reduce the development of new strains of COVID-19 virus is to make sure that we ramp up vaccination and eliminate COVID-19 by attaining herd immunity. As soon as we can achieve herd immunity, when at least 70 to 80% of the world's population have been immunized, then we can reduce the transmission of COVID-19, and so by so doing, reduce the probability of newer strains developing. So I think that's where we should be looking at right now.
We appreciate your time on the program, public health consultant and pharmacist Nsebasi Ekanem. Thank you for joining us.
You're welcome. Thank you for having me.
Still to come on the program, we find out about the critically ill COVID-19 patients in a comparison between first and the second wave. Please stay with us. As part of efforts to support governments in achieving universal healthcare coverage, a group has donated hospital equipment, education materials, as well as COVID-19 PPEs to the Yobe State government. During the presentation in Damaturu, the state capital, the Plan International project manager says apart from the original donations of the hospital equipment, his organization had keyed into contingency plans to reduce the spread of the virus through sensitization. In the meantime, the Yobe State Commissioner of Health, who received the items on behalf of the government, applauds the initiative while promising that the items will be distributed judiciously across 10 primary healthcare centers in the state.
The policy of the government is achieving standard and functionality. Without equipment, this human resource cannot be able to provide the desired services. And as such, the program also supplied these equipments, which will be distributed to the PSC centers that have been completed.
COVID-19 came in the midst of the implementation of the project, but of course the project was also able to quickly do a contingency plan that incorporated the implementation of COVID-19 preventive and response measure throughout the different stages of the project. So from the community to the different levels at the state level and local government level, we're making sure that COVID-19 guidelines are being implemented.
Julian Ojebo is a former Vice President, Nigeria Association of Resident Doctors, NARD, and Senior Registrar, Anesthesia, Critical Care Medicine. He joins us now virtually. Thank you for joining us on the program. I'd like to begin with, you see the wars of critically ill patients from COVID-19 every day. Paint us a picture of what it is and how you feel each day.
Good evening, Millicent. Thank you for having me. It's going to work on the daily is actually a mixture of bittersweet feeling because you go to give your expertise to the people that actually need your expertise, but sometimes for one or two reasons, these persons may end up losing their lives. So it's kind of like both bitter and sweet at the end because some of them do survive, some of them do make it to the end. And when you do that, you have this joy that you've actually given them the best you can actually give to them. It's not been easy. It's close to a year, over 300 days now since the last, the first episode of the COVID-19 virus itself. So it's not been easy for the past 364 days. I would say that.
For the wards you visit, how different is it now when you compare it to the first wave?
Yeah, I'd actually say that compared to the first wave, owing to the fact that most persons, they actually know what they were fighting or what they were grappling with. Most persons actually presented to the hospital or care facilities earlier than normal. But the second wave of the COVID-19, we do have a lot of people coming in as a result of either ethno-tribal sentiment, either because of poor understanding of the COVID-19 disease itself. So what we have now is more persons coming in quite late as compared to the first wave. Prior to now, the first wave, most of us actually thought that we were going to be contracting the disease as we go, but thanks to science that made us understand that with adequate use of personal protective gears and equipment, we can actually combat these diseases from getting to us. So yes, these are the things that actually have differentiated the first wave from the second wave. Are the patients getting sick, more sick than they actually came in the first time? Not necessarily. But what we've noticed is that there's late presentation, and late presentation actually leads to poor prognostic outcomes. So that's what we've been grappling with in the second wave.
So essentially, would you say that the messaging isn't working and there needs to be a lot more of that in communities?
I'd agree to that. A lot more has to be done. in dispersing this information to every nook and cranny of the country. It's so even surprising that even some of the elites that we actually think has so much information, as it were, to technology, they really don't even know these clinical signs and symptoms when they see them. And also because of our different faiths and religious, ethnic backgrounds, some of us still don't understand the weight of this disease on these comorbidities, background diseases. These are the persons that actually are supposed to be more conscious. Take for example, someone with a restrictive airway disease like asthma, and the person over time has 2 to 3 episodes of asthma per month. Such an individual knows that he equipment vis-a-vis the use of face masks, washing and hand washing, use of hand sanitizers, obeying the normal normal 1 to 2 meters social distancing rule. So these persons need to understand that they need to obey all of these NCDC background checks that we are supposed to actually do. If you actually check now, you go to see that most of our churches, most of our mosques are highly populated, highly dense. The persons that are actually supposed to relay these informations to them, the pastors, the imams, the clerics, they are actually not doing so much of the job as to letting them know that they are actually supposed to obey these guidelines. So yes, I agree that these informations are actually not trickling down. The elites in the society also not helping matters, as it were. So yes, I would agree to that.
All right, we appreciate your time. Thank you so much, Dr. Julian Ojebo, former Vice President, NARD Association, and Senior Registrar Anesthesia, Critical Medicine. Stay safe. Thank you for joining us on the program.
Thank you very much. Have a nice day.
Now, the drug maker Moderna is set to begin testing a new version of its COVID-19 vaccine that was specifically designed to target an emerging variant of the coronavirus first reported in South Africa. It found its current 2-dose regimen generates a weaker immune response against the strain from South Africa, though the company said antibodies in patients remain above levels that are expected to be protective against the virus. Well, here's more on the global COVID-19 update.
The information from the UK comes as global COVID-19 cases exceed 111.7 million, with the total related fatalities surpassing 1.47 million, according to the World Health Organization. According to figures released on Wednesday evening, nearly 10,000 people tested positive for COVID-19 in the UK, bringing the total number of cases in the country to over 4.4 million. Meanwhile, over 18 million people have received their first dose of COVID-19 vaccine by Tuesday. Over in South Africa, the government is aiming to get 1.1 million people vaccinated by the end of March. It started rolling out the Johnson & Johnson vaccine last week. So far, 32,000 health workers have been vaccinated. The United States still has the highest number of COVID-19 cases in the world, with over 28.3 million cases and over 500,000 deaths. President Joe Biden on Wednesday extended a formal declaration of a national emergency in response to the COVID-19 pandemic. The declaration was brought up on March 13 last year and originally set to expire after 1 year. More inoculation campaigns continue worldwide. Syria says it has just received COVID-19 vaccination doses from a friendly country, and healthcare workers would start receiving inoculations next week. Health officials say Syria is engaged with Russia and China on vaccines, but no bilateral deals have been announced yet.
Continue to take responsibility. If you have symptoms associated with COVID-19, please visit one of the sample collection sites in your state to get tested. For more information on the pandemic, you can take a look at our website. It's channelstv.com, where there are several stories there at your fingertips. That's the program. Thank you for watching. I'm Millicent Nwoka. Stay healthy.